Okay, again, welcome to the UTS Palliative Care Information Session evening here today. Thank you for taking the time out of your evening to join us and learn more about this course. Just before we get started and I hand over to our presenter this evening, I'd first like to pay my respects to the Gadigal people of the Eora Nation, upon whose ancestral land our city campus now stands. I'd also like to pay my respects to elders both past and present and acknowledge them as the true custodians of knowledge for this land. Just a heads up that we are recording the session this evening. We're just going to be using that recording to send out to people who weren't able to make it this evening, and it may end up on our course page as well. But just know that none of your private information that you use to register or that is on display will be used in a public-facing format. That's all protected, and we'll make sure that the final edit of the video does not include any of that information. As well, just a bit of housekeeping. So we have a Q&A section at the end of the session, so please feel free to throw your questions into the Q&A function that you'll find in your Zoom interface, and we can get to those questions towards the end. And the presentation slides that you're going to see, or that you're about to see, we're going to send you a copy of those as well. So don't feel like you have to jot down anything in a hurry if you see some important information, as you'll be getting your own copy of the slides. Okay, I'd now like to hand over to our presenter this evening, Michelle Giacomo, who's going to talk us through the formal parts of the presentation. Michelle, over to you.
Thank you. Thanks, everyone. Hi, Michelle Giacomo, and I am the course director for the palliative care postgrad program here at UTS. I'm an associate professor and I am based in IMPACT, which stands for what you see on the screen, Improving Palliative Age and Chronic Care through Clinical Research and Translation. So that's a research center and we are within the Faculty of Health. And I will be joined shortly by Professor Mira Agar. She is the director of this research center, and she is also a fabulous clinician. So she'll probably pop in at some point. So I'll just move on and tell you a bit about the course. So these are some of the things that I will touch on tonight. Talk about palliative care at UTS and the postgraduate learning space and what this might look like for you. I'm talking tonight about entry into the course in spring session 2022, and so that really actually begins, the orientation week is the 25th of July and the first day of classes on the 1st of August. Some of the things we'll talk about are here, so a bit about the structure of the existing course, learning modes, and some of the support that's available and how to apply. So the course was developed just a few years ago here at UTS, and we did this because we recognized the need to have more opportunities available to gain palliative care qualifications. We have expert staff and a panel of stakeholders that really help to inform the content in developing all of these subjects. We're the only palliative care course that's actually anchored within a research center at a university. So it means that we're really at the forefront of palliative care research. You know, we know what happens when, how it happens, how it influences practice, and how we apply it. So all of our subjects contain research that's, you know, ideally hot off the press. It'll be part of your learning. And in several cases, you'll probably have the researchers themselves contributing to some of the teaching. The graduate attributes built into this course were designed in collaboration with clinicians and our expert advisory groups. So we've made sure that what we've embedded into the course content can really be applied at the bedside. And of course, we have flexible and supportive environments, and there are teachers working with you who really do want you to succeed. So in thinking about choosing the right postgrad course, this slide depicts some of the structure. So we offer an articulated program of study with, you know, flexible entry and exit points. And this means you can enter or exit at the grad cert graduate certificate, graduate diploma or the master's level. So students can enroll in the course at any level and change their mind if they need to, or enter and exit at different levels. So here's just a little diagram of the structure. So at the bottom left, if you see the very pale kind of honeycomb hexagon shapes, those are the 4 subjects that are part of the graduate certificate. And then another 4 subjects is the completion of the graduate diploma. And then an additional 4 subjects on top of that is the master's. So with this nested course structure, even for those of you with any recent graduate certificate or diploma or relevant recent postgraduate subject, there's an opportunity also to get some recognition of prior learning that would fulfill some of the requirements in these courses. So you might potentially have fewer subjects to complete if you're completing the master's. But everyone's pathway is different. We have students from a range of disciplines with us now enrolled, and we look forward to more of that. So we have nurses, we have pharmacists, physiotherapists, we have doctors. But if you want to have a chat with me, we can do that to get a better idea of what your pathway would look like, given your qualifications, your discipline background, what your goals are in terms of what you would want to get out of the course. So who are our palliative care courses designed for? I guess, events of recent years have really shaped these courses. We've had COVID, post-Royal Commission. We've really moved into a model of primary palliative care, by which we really want to see clinical champions in every area that have some, palliative care qualification. So whether you're in ICU or you work in community, if you're working in rural and remote areas, even at nurse practitioner levels, actually having people in these spaces who are champions and leaders in the field are what industry wants and what clinicians actually want. And this is across Australia. So we have some students who are enrolled from let's say Cape York to WA, they're enrolled. So they can actually provide those people they're caring for in their areas in regards to symptom burden and end-of-life care. So anyone who's a registered health professional in any practice level from any specialty area who wants to extend their palliative care capabilities is really who we want in this course. You'll be building clinical performance capabilities, critical decision-making skills, leadership skills. You will develop as an advanced clinician. And a lot of the skills we're building with you that we discussed with industry are around topics and interests that you may not have encountered before. So for example, building business cases to advance your services, whether at a ward level or a state or a policy level. We'll equip you with skills to be able to put your case forward so you can deliver palliative care to those people, anywhere, anytime. And here are some of the current subjects in the current structure. This course was really designed to be 3 years part-time. I mean, you can always do it full-time. That's different, but that's fine. 3 years part-time, so it's about 2 subjects per teaching session. We have a selection of subjects that are shown here. So you would be starting off in that first year with communication and collaboration for optimal person-centered care. This really involves, some of the topics are about implicit bias, and also just, communicating to provide care for different types of people, some of whom have been marginalized and what effect that's had on them, and considerations around that. Another of the first year subject, delivering best palliative care any place, every time. It starts out with this, you taking a helicopter view of what services deliver palliative care where you're working, and how do you work out if populations in your area or your LHD are or aren't receiving palliative care. Are some people missing out? What's really going on there? And if you're starting in spring, which is what's coming up, conflict symptom management is one of the spring subjects that you start with, and that's around the main symptoms across various diseases. So advanced heart failure, we talk a bit about stroke and oncology, palliative care as well. So we talk about what are the complex symptom management issues and the strategies that you should really be considering, how you should be guiding colleagues, what screening tools you should be using, for example. In the second year, immersive palliative care futures. So how do we use technology, telehealth, virtual models of care? How do we ensure we get palliative care to people to stop them from unnecessarily coming into hospital? Another one that students have really liked quite a bit are the next two subjects, the ethical dimensions of palliative care and legal dimensions of palliative care. So some topics covered, for instance, involve different states' rules around euthanasia and implications for health professionals. So that's one of the things discussed. And in the third year, that's for the full masters, that's the capstone, and so there's always a research component there. So you will have taken a year 2 subject to prepare or refresh you in regards to your understanding of research. But the rest of the third year subjects are really around advanced clinical assessment skills, advanced communication skills, and advanced pharmacology skills. We actually had feedback from a student from a last year's session about the advanced communication skills. She's actually a very, expert clinician, great communicator already. And at the beginning, she kind of wondered, what am I going to get out of this advanced communication subject? Having, being responsible for a service that has a lot of interaction with palliative care patients. But on completion, she actually told us that she did learn something new each week in those communication subjects. And she's been able to implement those learnings across her service. So that really spoke to the novelty and the relevance of the content, even for already highly skilled clinicians. So in regards to learning, these courses are completely delivered online using a platform called Canvas. It's not a passive learning mode. It's, you log in, you certainly don't work completely independently. So you're not left to your own devices over the whole semester. You have a relationship with your teachers for each subject, and you will get to know and interact frequently with other students. So we have Zoom sessions between 3 and 5 for each subject that you take. These are live interactive sessions. We don't use traditional lecture formats with PowerPoint slides during the Zooms. Rather, there's opportunity to discuss some of the concepts that are coming up, maybe work through case studies or discuss, what's going on. Oops, sorry. So in regards to support that is available, we have various support mechanisms in place, includes the Student Center, helps using subject timetables for planning, and a great library. And I mentioned that the subjects are delivered in Canvas, and that's the online learning platform. And within this, we've actually developed a palliative care community site for students in each of these palliative care courses. So they're all able to access this information anytime they want. It's got a lot of these relevant support links and other contextual information about palliative care. It's kind of a one-stop shop of supports that make it pretty user-friendly. And that's particularly important for people who may not have really studied formally for a while. And as I mentioned already, the teaching team is also very supportive of the students. They appreciate that students are busy clinicians. So in regards to fees, these are based on credit points per subject. So our subjects are either 3 credit points or 6 credit points. In 2022, credit points were about just over $400 per credit point each. So $419 per credit point. So a 6 credit point subject was about around $2,500. And that's non-Commonwealth supported. So it's less cost if it is a Commonwealth supported place. But this makes the graduate certificate, for example, around about $10,000 in 2022. And you can have a look, it's very handy, the UTS fees calculator link. You pick your subject in it and the website is here, and you will be getting the slides, as James says. And the calculator gives you the costs for what that is. So there are some Commonwealth supported places, and we find out just year to year how many there are. There are scholarships in health districts at the moment across Australia. So the government has recently put a lot of money into palliative care. So I would encourage you to contact whomever is in charge of your kind of education in your workplace and let them know you're interested in doing this palliative care course. We've had a number of students who had some or all of their subjects paid for in this way once they showed interest in doing this qualification with their education person at work. Alternatively, there are some scholarships offered by external organizations such as the Health Department and the Australian College of Nursing, or even general practice. Also, there's fee help for postgraduate students, and you can see some of that information here and the links on this page. So again, you'll be sent the slides so you can have a look at some of that. Putting in an application. We do take applications all year round, but they close on certain dates. So you can see here that spring applications or applications for the spring session are now open, and the applications need to be submitted by the 26th of June for that spring session. And for anyone who may also be considering trying to get some, prior learning or credit recognition, as I talked about it briefly before, it's important that you make a point of speaking to me about it because that actually happens after enrollment. So that's a good thing for us to talk about in regards to, planning your study. But once we discuss that, there is an application process that you can access online. Right. Okay, and that brings me to the end, and I do see Mira Agar, who I mentioned would be joining us, and she's online as well. Over to you for questions.
Feel free to throw questions into the Q&A for either Michelle or Mira. I actually have some that have come through to me directly, so thanks for that. The first one is, sorry, I may have missed this as I arrived late, but I'm just wondering if the course is completely online or are there some face-to-face opportunities / requirements as well?
No face-to-face requirements. And at this point, it is online completely.
Okay, cool. And the next one is, how many approximate hours a week will I dedicate to coursework? And is there flexibility with this?
Yeah, that's a very good question. And that's the kind of thing you need to get your head across before you enroll in something like this. So each of the 6 credit point subjects, and we predominantly have 6 credit point subjects, you can expect to study, and this is an average, like a range of 7 to 10 hours per week per 6 credit point subject. So if you're doing 2 of those types of subjects per session, so consider it to be, what did I say, about 14 to 20 hours per week study. And that is averaged, and that across the whole session of 12 weeks. And also it includes time on the Zoom sessions, time spent doing, readings and working through the material online, and also working on assessments and submitting assessments. So that's the kind of gauge that we tell people. It can be more or less some weeks, some might be particularly light weeks, and then maybe, when assessments are coming due, you're spending more time online, but that's generally what we have students plan for.
Great. We have a few that have come through in the Q&A now. First one is, how recent does study have to be for recognition of prior learning?
Okay.
I think it's within 10 years, I think. Is that right?
It's 10 years pretty much for this course. So within this palliative care course. So that's a pretty broad time frame, because other courses it's 5 years. So, but we will consider postgraduate subjects that are relevant to see if they, can take the place of maybe an elective or other equivalent subject.
Cool. And then second one is, can you opt to do one subject per semester rather than 2?
Interesting question. I do know that things happen in life and, things come up. Ideally, we do want you to plan for doing 2 6 credit points or the equivalent of 12 credit points per session. But sometimes things happen and you need to make a change. And we'll just kind of work with you to kind of do a bit of restructuring around when you'll be able to take that, the next required subject again. So it does happen.
I've got another. Oh, this one's actually for me. So yes, the presentation will be sent out to everyone. And no worries for arriving late. That's completely fine. There will be a recording as well, but the recording won't be available straight away. We'll do a little bit of editing and we'll caption it, but I will send you a direct link to where it will live, so you can check back in a week or so. But you will be getting the slides. Yeah. Another one from Kathleen: Can subjects be studied at random if not wanting to pursue a formal qualification?
So not enrolling, is that what you mean? Maybe not enrolling in a course?
Yeah, maybe just enrolling in subjects.
I've not come across that yet. I think a lot of students opt to do the graduate certificate and try that out. And that's 4 subjects, and that can be completed in the year. So we haven't come across that. So I'm not exactly sure if you're not already a postgrad student at UTS, I don't think that's an option if you're not already a postgrad student. Yeah, but please feel free to correct me, James and Mira.
I'm not completely sure, but Kathleen has given some more details. She says, I already have a graduate diploma, but just want to refresh.
No, we do run masterclasses with some of our local health district partners, so that might be one opportunity. And there is discussion around other models of learning going forward in terms of sort of supporting industry, but those are still under development. So if you would like us to let you know if those are being developed, we can always keep you informed about those types of opportunities. But I think those are things that could be in the pipeline, but not available just yet, unless you work in some of the local health districts that we work with.
Great. Someone's asked directly, how do I get in contact if I want to talk about my recognition of prior learning? Michelle, if you flick to the next slide, I think we've put So the first email address would be the one, not the general health email. Flick your inquiry through to that email address, and we can have a discussion with you around that. Anything else to add on that, Michelle?
No, that's an excellent instruction.
Okay.
The PalCare email.
Cool. Any other questions for Michelle and Mira? Any questions at all? No silly questions? Well, look, I just want to thank Michelle. for the presentation, and Mira as well. Thank you for being here. If you do think of a question after we finish the presentation, feel free to email that email address with those questions as well. That's palcarepg@uts.edu.au. Best to just stay away from the general one. Specific courses about the course, it'd be better if it goes through to the Palcare team. Okay, well, it looks like we don't have any more questions, but I want to thank everyone for attending. Thank you for showing up, and I hope to have some more conversations with you down the line. And thanks again to Michelle and Mira. Thanks to you both.
Thank you, James.
Lawrence says thanks. Very helpful.
Thank you.
Okay, well, we'll call it there then. And I hope everyone has a good evening.
You too.
Thank you.
Bye.
Bye.